The timing of breast reconstruction may be variable depending on a patient's circumstance. The most common circumstance in breast reconstruction is what we call immediate breast reconstruction. This means that a patient's breast reconstruction is performed at the time of the mastectomy, in other words, simultaneously. In these circumstances, the patient typically has cancer. The patient comes into the hospital and undergoes a mastectomy, either for one side or both sides. And while the mastectomy is being performed, the plastic surgeon will be preparing the donor site, most commonly the abdomen, for autologous breast reconstruction. And once the mastectomy is completed, the tissue or skin and fat from the abdomen is harvested and transferred or transplanted to the chest to reconstruct the breasts at that time, therefore making the reconstruction, as we say, immediate. There are also circumstances in which we would have what's called a delayed reconstruction. Delayed breast reconstruction occurs if a patient has had mastectomy in the past and no reconstruction, or mastectomy in the past and a reconstruction which didn't work out. For example, an implant reconstruction which failed due to infection, or if they've had a reconstruction in the past which didn't work out for some other reason. They come to the reconstructive plastic surgeon requiring a reconstruction, but the mastectomy has already been done. In these cases, we call this a delayed breast reconstruction, and the patient comes in on the day of surgery and has the breast reconstruction on that day. The third category is called staged or delayed immediate breast reconstruction. It's a combination of the two terms. This is an opportunity for the patient to mix and match the patient's practitioner. In other words, there are circumstances in which a patient is in a situation where they're very comfortable with their breast surgeon and they want to maintain that relationship and they want to continue to be seen by that breast surgeon and have that breast surgeon do the mastectomy. But it may be impossible for the plastic surgeon and the breast surgeon to work together. In these circumstances, we would do what's called a delayed immediate, wherein the patient would have the mastectomy on one day, and then about a week later, or it can be more than that, up to about 6 weeks, the patient will already have been scheduled for the reconstruction by the plastic surgeon at another hospital. This has several advantages. Number one, the patient can choose the breast surgeon of her choice and the plastic surgeon of her choice, even if they're in different locations. Number two, it gives the skin, and particularly in the case of nipple preservation, the nipple, a chance to recover from the mastectomy before further traumatizing it with a reconstruction. And it gives the plastic surgeon the opportunity to focus solely on the task at hand, which is reconstruction, and so that operation is quicker and potentially the outcome is better. One other advantage would be with respect to the oncology. If there's any question about the pathology of the specimen that is removed with the mastectomy, by the time the reconstruction is done, we would know whether or not more surgery needs to be done in order to treat the patient's cancer. I hope this has been helpful to you, and please don't hesitate to email me or contact my office if you have any questions or would like any more information about this. Thank you.